this group found is that 36% of the patients who have been admitted in the hospital had neurological manifestations, and patients with the most severe form of COVID had neurological manifestation. Quickly in this table, you see that the most common were the central nervous system, so dizziness, headache, impaired consciousness, and much less the peripheral nervous systems. So for this reason, in the European Academy, we decided to set up a survey to try to understand in Europe what could have been the impact for neurologists of the COVID. So we started this survey in the 9th of April, online, the 9th of April, and we just decided to close the survey today. So we had 4,600 responses. Most of the people who responded the survey were neurologists. And in this slide, I just show you what were the most common symptoms that our neurologists they saw in patients with COVID. These neurologists, they were asked most of the time to go and see these patients who had COVID and this neurological manifestation. You can see that headache was one of the most frequent manifestation, impaired consciousness, psychomotor agitation, anosmia, which is a trouble of smell, algesia, a trouble of taste, and myalgia. So you see the colors, just to explain. So this, the light blue and the yellow, they means moderate and high frequency. So all the other symptoms, you see a very long list, they were present, but less. I just put a star in the most frequent ones. And because there are a lot of publications, but I will say not all the publications, and maybe my colleagues will tell you something more about. Not all the publications, they have a very high quality. This one, which is just came up, is from UK. There is a network of people in UK, mostly neurologists, but also psychiatrists, who started collecting the neurological and psychiatry manifestation. So what you can see that in 125 patients included, most of them, they had a stroke. And most of the time was ischemic stroke. We discussed about the thrombotic mechanism of the virus, but also altered mental status. You remember that also in China, they observed that. Encephalopathy, encephalitis, but also neuropsychiatric disorder, psychosis, some trouble in cognition, and other psychiatric disorders, and much less the peripheral nervous system, which maybe in the future we'll see a little more, because sometimes these diseases, they take more time to become evident. So the other initiative you say about, it's nice to have an idea about the impact of COVID, but what about patients, as we say, neurological patients who have already a problem, Parkinson's disease, multiple sclerosis, whatever, epilepsy, headache? How can neurology manage these people during this massive pandemic with all the problems that we discussed before? So the European Academy has scientific panels. I mean that each sub-discipline in neurology has the most important expert in the field representing this subspecialty. So we ask each of them to give the neurologist, the general neurologist, the recommendation how to manage patients with Parkinson's disease, for example, during the pandemic. What to do with the multiple sclerosis patients. Maybe they are, more vulnerable to the virus. So all these recommendations are in the EAN website, but also several countries inside the French, for example, the Germany, the Italian societies, they set up some guidelines for their own population of neurologists and internal medicine physicians. So just to give you the idea, this is a paper published from Italy concerning patients with multiple sclerosis. So how can the virus impact patients with multiple sclerosis? So to give an answer, we need to have some registry. And this is what they've done in Italy. So they collected 232 patients with multiple sclerosis. And you see that 55 were confirmed with the test, the nasopharyngeal test, and the other they suspected they had the virus. And most of the time, even patients with the immunosuppressed agents had a very mild symptoms. And only a small part, thank God, they have severe disease. And unfortunately, some people died. But when you see why they died also, you see that they had a lot of comorbidities, diabetes, cerebrovascular disease, hypertension. And you know from the news that these are the most common risk to have severe and also to die in other people who don't have any neurological disorder. So they concluded that probably if you have multiple sclerosis, you don't have a different outcome or an increased infection risk compared to people who don't have MS. And these are very important observations that they also contribute to release the anxiety of the neurologists, not only of the patients. So don't ask me to give you my impression as a neurologist. This is our more personal impression about the challenges and the opportunities during this pandemic. The challenges that the neurologists have dealt with, and also our patients, I think is lack of knowledge and evidence. We don't know a lot about this virus. Now we are accumulating the knowledge, but nobody even knows if we will have a second wave or not. And as I discussed before, even the papers that are available online, most of the time they're all not peer review or just accelerating all the process, so the quality of what we see as information is not always the top. Then there is a huge misinformation. I give you an example. Today, came to the ER here in Grenoble, a patient who had been multiple strokes over the last 3 weeks, 60 years old. And why he came only today? Because he said, well, I understood that I could not come to the emergency room because it's only for COVID patients. I was scared to come. So this patient missed the opportunity to be treated effectively because of this misinformation. So we have patients that discontinuing the care, delayed care, huge anxiety, depression, isolation, and a lot of social disparities. So overall, we have this incertitude for the future and the strong impact on clinical neurological research. We stopped almost all the clinical trials. But from the other side, I see also some opportunities. So we saw that the scientific community has been very active. We tried to do the most we could do to understand what was going on, and we tried to find a solution. There have been a lot of networking and collaboration among physicians, scientists, trying to work together to find, as I said, a solution. You mentioned before, so the explosion of not only Zoom, GoToMeeting, the telemedicine. How can we reach our patients? Because they can't come to the hospital. So no, we call them. We use any device to get in touch to see them. And this adaptation. So we have discovered that we are able to adapt to this new, very difficult situation. So to conclude, so what we are learning, because I think we are still learning a lot from this pandemic, and what can be the next step? Well, we have learned that we can be essential. We don't need so many things. At the end, we can also survive in these very dramatic times, but we need to improve information. specific to population location, because what we are saying in Paris, I give you an example of France, is not the same as in Grenoble. Some areas have been not so hidden by the virus, and they've been treating like the others for good reason, but the information should have been given properly also for that. And then, as we say, we found that the healthcare systems, they need to be fixed. But also the next can be, we have learned that we can modulate our clinical activities. We can be much more flexible, no? Sometimes we just give more phone calls. We can use these technical advantages. And we need to improve the multidisciplinary. We take this moment that we have been working together and integrate better the care of our patient, to talk with the other physician, with the other stakeholders. And the better organize it in home care and also the long-term care facility that have been hit badly by this virus. And also for neurology specifically, we need to follow up our patients and also the subject who have got the virus, but without neurological comorbidities, because we know that in the past, some viruses after years have induced some neurological problems.
Thank you so much. I thank you, EFNA, for the invitation, and I'm honored to speak to all of you. And I think that we all have in mind the images of something that until 3 months ago, we really didn't know and we didn't expect. And this is yesterday's view from the WHO. We are now more than 4 million, reaching today almost 5 million people confirmed cases. And I'm talking from one of the most affected, at least at the beginning, countries, that is Italy. Yesterday we had more than 32,000 people that died in the last 12 weeks. And really our country has been deeply affected by this. And I think everybody will remember the 19th of March, this image went throughout the world where we had these vans of the army that were transporting the dead bodies of people dying for COVID in Bergamo, that is one of the most affected areas in the north of Italy. And I think that now that we are going in Italy in the phase 2, although other countries are still in phase 1, we as a country has been living this, been sharing this experience with many other countries, and the lockdown has been affecting a lot care, patients, but also people who are not patients, and has been affecting in general the whole societies. And if you look at the chronic patients who are already, and I think in the introduction from me, we have seen that there are already issues that are taken care before any kind of pandemics, but in this study, which is conducted during April in the US, France, UK, Germany, Spain, and Italy by Data Media Company on 400,000 chronic patients whose average is 52. The question is, what is the issue for chronic patients? And since the beginning of the lockdown in those countries, 40% of the non-communicable disease were reporting that during the lockdown they were consulting their doctor less than usual. 0.5% have stopped their treatment altogether, and 5% have temporarily stopped taking medication. 10% say they have difficulties in finding prescription in pharmacy, and this is really show that when big events happen, people are already in care, might suffer, and this in the emergency plan of the WHO was planned and considered, but apparently no country, and we weren't prepared, even though it's written to be prepared and not to be prepared. But these weeks, as has been already said by all of the previous speakers, really are 12 weeks of increasing knowledge and sharing of it. And I think that this is really something that has been making us change, and it's in line with what was said before. We are moving from different approaches. And I think at the beginning, this virus disease has been seen as something that was starting as a pneumonia. But as Elena Moro said, it became very clear that also the nervous system and many other systems, and it is like a series of waves that come one after the other. And coronavirus is teaching that the systemic approach is the one that can help us to beat this disease. And I think that for chronic diseases patients, this is really known. Usually a person who has chronic disease, they don't have one disease, but they have a multiple series of them. And a global approach is certainly more useful and more effective than just a monospecialty one. As you said, Donna, I had the opportunity to be seconded by the National Neurological Institute of Milan to Brescia. And I was there to coordinate the COVID research. And in particularly, I had the opportunity to work with the neuro-COVID unit, that is the first neuro-COVID unit that has been opened by Professor Alessandro Padovani in Italy. And in Brescia, they had more than 3,000 cases of patients joining the ICU. And we had been doing from the beginning, because we were trying to understand the different symptoms that were coming to us. And in collaboration also with the American Academy of Neurology, Justin MacArthur, we have been trying to find what was published. We were contacting the Chinese, we were trying to understand what's happening. And in collaboration with many colleagues throughout the world, we were trying to understand what's coming. And we were looking at what was coming, but at the beginning, not so much as the flow of information that came out after. Certainly, we had also special cases and different cases that were presenting to our and that have been reported. As Elena said, the flow of literature was really enormous. But there was also something different that I think is of interest for today, and it is that although science was coming and the emergency was coming, the more the emergency was coming, there were a lot of human rights issues, both for the health professionals who were sort of unprepared to face these epidemics in the proper manner in many countries. The protection, the individual protection of health workers has become an issue, and this is also connects with other issues like accessibility to healthcare. And for some countries, there has been areas for stigma and discrimination for access to care. I also work a lot with the disability community and with the aging population, and there has been many, many issues around the world. And the vulnerable population has felt like this emergency was bringing up a new Darwinism in which lack of resources and healthcare resources was also going to impact a lot on those who are the most vulnerable for sort of choosing who can access. If you have only one respiratory issue, who would you choose? And this kind of question has gone on and on. The Patients Association have been discussing this from the beginning, and I've been also working with the EFNA and the European Patient Forum on this. But I would say that we have been all seeing, at least in the most affected countries, something that our neurology and neurorehabilitation colleagues in Italy were calling the heartbreaking scenes. We cannot forget what we've been seeing, although now it seems that we are going out of the acute phase. However, many, many people have been suffering for a sort of isolation and solitude and loneliness. That was the thing that was affecting all of us. And as Elena said, the kind of long-term effects of the disease may not still be discovered yet. Although the SARS-CoV-1 and the MERS, the other coronavirus diseases, were producing some effect in the long term, they didn't have the numbers that are now going on. 4 million people affected by it. Of course, only 10% might be the very, very serious one that have some sequela, but these sequela need to be studied. And this is why I think what will be very important is to also see how the follow-up and the rehabilitation is going to move on in taking care of patients. We see many of the symptoms are well known because they are also related, for example, for the acute care, for a chronic illness myopathy, which are the chronic disease that come after you are in an intensive care. But there will be need for other healthcare things that need to be put on the front line and need to be considered by health system. For example, neurorehabilitation will be something that for our patients who are going to need the strongest support by the healthcare system will be one of the things to put in place. The World Federation of Neurorehabilitation has set the guidelines to be shared. And I wish to conclude saying that this week took place the World Health Assembly, and I think you've all heard the resolution that has been approved on the 19th, which is the resolution that I show in front of you here. It was presented by almost the majority of countries, and it was a call for a global response of the WHO to what is happening to people. And I wish to underline that in this resolution, it was mentioned that all the countries, and as this resolution has been approved, this is what WHO is going to support, it has been requested by all the governments to provide assistance to countries to support safe functioning of health systems in all relevant aspects necessary for an effective public response, not only to the COVID pandemic, but other ongoing, but also, and I think this is where EFNA and all the other patients organizations should also have a look at this point of the resolution, then there's the need for the governments to provide an uninterrupted and safe provision of services to population. In this, the non-communicable disease and mental health are put there. I think that we always lack in putting the word neurology there, but we can find our space within this resolution and use this resolution as something that within governments could be used for supporting. And there is also many initiatives. There are initiatives Europe is doing through European Academy of Neurology, but also the Chinese Neurology Academy is doing something, and the American Academy of Neurology. That is why there is the need from many organizations to come together. So research is not belonging to a continent, to a nation, or to a country, but research on this matter is global. And the results of this, I think this has been said many, many times, but all the big leaders of the world, including the President of the European Commission, European Union, that the results of research are not belonging to anybody, they are common. And I think this is the message that comes out of these big pandemics. It's impossible to come out with such a pandemic with results that belong to something. It's not European, it's not American, it's not Chinese. Whatever comes out of this should be global. And this is why big coalitions are called and big collaboration. This is what science does. This is what scientists do. And this is what we hope science can push politics also to do, because nobody wins alone. And this is something that came out very clear out of these epidemics, because only together we can beat coronavirus. Thank you.
Thank you very much, Matilde. I think, again, you've given us a different perspective, but very complementary to what Elena had presented earlier. Before I move on to Monica, I just saw there was a question in that I will put to you, Matilde, but also Elena, maybe you might want to chip in on this question as well, which was around the backlog that we're seeing in the system. So a number of neurology patients obviously have had appointments cancelled and so on. And I believe in the UK, there's a 7 million people being on the waiting lists. How are we going to deal with that in terms of the way the healthcare systems are set up at the moment? Can we deal with that? So Matilde and then Elena.
Yes, we can deal with that, because at the end what we have is that the neurological care has been temporarily stopped, but neurologists didn't disappear. What I'm saying is that the system are there. The point is, as mentioned by Elena, one of the suggestions that we have is certainly to improve and to facilitate access, maybe using other means like the telemedicine, the telerehabilitation, the televisit, teleconsulting. This requires some changes for some systems and requires some recognition, for example, in terms of reimbursement and other things. The American Academy of Neurology has been releasing an online course on how to do the online neurological examination, which is one of the things that could be used and could be taught. And I also think that the structures for neurology are there. The point is, how can we rethink some of the structures so that nobody is left behind? And that is something that is feasible, but requires some thinking. And this has to be done together by doctors and patients' organizations, certainly.
Thank you, Matilde. Elena, have you got a perspective on the question?
I think this is really an important question. So what we are trying to do is a sort of triage, because as you mentioned, there is this long waiting list. People, we have to see them. So a triage can be really try to catch up, asking the patient, do you really need to come in person, or I can see you with Zoom, telemedicine, in the way that each hospital is trying to organize himself, or just you want to come, I need to see you. And this really depends on the type of disease that you are treating, and also the relationship that some patients they have. Some patients, they want to come, even if there's still the COVID, because they need to be examined, they need to have to come in person. Or some patients, I mentioned I'm a movement disorder, person. So patients with Parkinson's disease, sometimes some of them are alone. They don't understand how to use a phone for connecting to Zoom. They have a lot of technical issues. So I can't, I can't examine them. I can't sometimes even understand what they tell me on the phone. So it really depends on the subspecialties. So we have to adapt to find a solution. We don't have everything already to offer, but I think we will, together with the caregivers, with the patient, we will find a solution to recover the lost time as soon as we can.
So a big opportunity for patients to start to get involved in how we can shape the way the system is set up. Matilde, quickly, and then I need to move on to Monica.
When we plan things, we have to consider that this kind of online visits or something, they're not accessible for many patients. Many people don't have the line, they don't have the connection, they don't have internet. Many are quite old or aged, and they don't have the kind of mobile tools that are necessary to provide this kind of new health. I think this also should be considered when planning to move many things online. So not only the physical and relationship and contact, but also the technical difficulties of putting everything online when almost only 55% of people above the age of 50 is online. And we have to consider that Europe is very big. So this is also something that we should not forget.
And maybe we'll have some suggestions for some of the speakers from patient organizations as we move through the agenda. So I'm going to quickly move on to Monica, Professor Monica De Luca. Monica is president of the European Brain Council, which is a multi-stakeholder organization bringing together all of the key players in both the neurology, but also the mental health space. And I think EPC has been really successful in advocating for brain research and more focus on neuroscience at a European level. And this is something that's been mentioned by speakers that, research has almost come to a standstill during the pandemic. And obviously we need research to continue if we want patients to have access to treatments and to care that actually works for them. So Monica, we'd be interested to hear your perspective on what the current challenges are in terms of research and development in the neuroscience space. And how potentially we can work with groups like EPC to really reinvigorate that as we come out to the other side of this pandemic. So Monica, I'll hand over to you.
Thank you very much, Donna. And I'm particularly grateful to be here. As all the other speakers already said, we are all living a sort of an unprecedented situation, particularly for our generation, I would say. And we will certainly remember all this for a long time. And it is pretty clear that this will change profoundly and impact profoundly on several aspects of our lives. So I really believe that it is just time to share some thought about it. And I'm particularly grateful to EFNA because they decided to take the lead on this and to open the discussion. And I would like to start saying that to me, this emergency at least allowed to reach a strong conviction. That is to say that we need a more competence overall in the area of public health to really improve and the coordination that is necessary to face an emergency like the COVID-19. So it is particularly clear that the COVID-19 basically posed a big threat in all of us, basically. And we know that at present, as Matilde already alluded to, we had something like an enormous amount of patients living with this. It's between 4 and 5 million. Europe has been completely overloaded by patients with a huge number of cases. And it has been immediately clear that the virus poses a threat on those living with pre-existing conditions, including brain disorders, and that the virus can basically impact directly on neurological aspects, leading to several neurological manifestations, as Elena Moro described so nicely, and Matilde as well. So I really believe, and I'm really convinced that we need to learn lessons out of it. And this is particularly important. And basically, the first good news, or the first lesson to be learned, to my eyes, which was a positive one, is that at all political and societal level, they all started to consider again research essential. I'm speaking the voice of scientists, of course. And they start to reconsider research needed to be rapidly supported, and funds allocation needs to be speeded up. So at all levels, we can say that we join forces to react and to face the pandemic, and scientists, societies stood together with policymakers. So we realized that it is possible indeed. We can face it. So basically, the COVID has shown us that research funding is crucial for our society. But it's also important in this particular moment that all of us, the brain community together, help in raising the awareness on the fact that other emergencies can raise and are already present. So let me say once more and again that 1 out of 3 citizens, and we all know because EFNA and EVC have been working together for many years in this background, 1 out of 3 European citizens are said to live with a brain condition. Most of these conditions are still vacant of a disease-modifying drug, and in most of the cases, research is disproportionately underfunded, and it is absolutely clear. The numbers are absolutely key to understand this, that I believe is an emergency. This means 1 out of 3, then 179 million citizens are living with a brain disorder. This is surprisingly high if we want to compare with other diseases, with other emergencies. Of course, these are data that are possibly a little bit old, but we know very well that mental and neurological disorders are responsible for the biggest numbers of year lost due to disability at WHO Europe level. And we know that this amount of an incredible numbers of daily loss due to disability, 62 million days. So in my opinion, the longer it takes for our society to understand that this is a constant emergency, what I call a ticking bomb. And the longer it takes to respond adequately to this challenge, the more difficult it would be to become to do so and to realize and to take action. And as number grows due to our rapidly aging population and with the brain leading to the highest cause of ill health and disability worldwide, as I just had already mentioned, the closer we get to a brain disease state of emergency. And this is how I will call it since now on. Let me say that it is a little bit difficult at this moment for a scientist or for scientific societies to predict and state how the present pandemic will affect research and development in the brain area, which is particularly close to our heart, for us, for our knowledge, and for the patients. Unfortunately, I have to say that in several member states, we already experienced the destruction of funds to infectious diseases that was needed, of course, to react at this pandemic. But would this mean a decrease of funds to brain space? I really hope not, because this would mean and would represent a short sight from our government and from our policymakers. So we know and we fear that research in domains different from viral infection stalled. And they were absolutely severely impacted by the measure that has been necessarily taken, for example, by the European Commission to postpone the deadline, to change the procedure. But also research that are merging clinical aspect to, let's say, more basic aspect that we are used now to increase our knowledge in brain disorders also stalled because the difficulties to reach the health system, of course, due to the pandemic and to be close to the clinical setting. So I really believe that as a brain community, we need to be proactive and not reactive. This means that we now need to learn the lesson that we learned from the COVID experience and try to profit out of it. For example, it is very clear to my mind that we should profit from the transition, for example, from the old Horizon 2020 program that has been delayed due to the pandemic of COVID-19 to Horizon Europe, that is the new one that should take place. It was supposed to take place in the summer, but will not be the case. we need to use this temporary transition and this vacation to show at European level that health is crucial for our society, as demonstrated by the recent pandemic, keeping in mind that the challenge posed by brain conditions are very high and is, as I said, a ticking bombs. That funds should remain absolutely uninterrupted and that equity resources should continue to be dedicated to the burden of brain disorders. Because let me say, and I will be very short because I simply wanted to share some thought on this role of research in the brain space in this condition. Let me say that under a so-called normal condition, not a reactive condition, under normal circumstances, to me, brain disorders are and will remain for Europe a state of emergency. And with this, I give it back to Donna.
Thank you very much, Monica. And we couldn't agree with you more that, you know, we need to really put neurology in that bracket and show that this is an emergency. You know, we were talking yesterday about the fact that some of these diseases were founded in the 1800s and we still have no treatments yet. Absolutely. You know, a new virus comes out and within a couple of weeks, it's all hands on deck to find a vaccine and a treatment and a cure. So if the same sort of collaboration could be brought together for neurology, we could be in a very different position. So I think you're right. We need to somehow capture this and twist it in our favor. And as Matilde presented, you know, non-communicable diseases are being considered and we need to make sure that we're seen within that. So certainly lots of food for thought. Thank you, Monica. So I'm going to move on quickly to the next section of our program, which is where we're really bringing the patient perspective to the table. So for the next 30 minutes or so, we will have 5 patient organizations presenting to us the feedback from their organizations and the patients they represent in terms of the challenges, opportunities, and recommendations for how we can really build on learnings from this pandemic. And the first speaker is going to be Mags Rogers. And Mags is the Executive Director of the Neurological Alliance of Ireland, which is an umbrella of neurology patient groups nationally in Ireland. Mags and her team have been doing a survey of patients in terms of the impact COVID-19 has had on them. And Mags, we're really looking forward to you presenting the results and setting up the rest of the discussion from the patient perspective. So I will share your slides and maybe you can share your video and introduce yourself.
Thank you to EFNA and to Donna for inviting me to present today. The survey, I suppose, it rose in response to, I suppose, concerns that are common across all of your countries of wondering what is the impact on people with neurological conditions and their families. And I suppose concern that there was a quiet majority there that we weren't hearing from. And we were wondering what was actually happening to people. We knew that people weren't presenting to services, they weren't presenting at neurology clinics, as in the example highlighted earlier of the person experiencing stroke. That was an experience we were hearing from neurologists. And so this survey, we carried out this survey was response to concerns of our own member organizations and also to neurologists and neurology staff that we were speaking to. That were concerned about the impact on patients. So if I could have the next slide there, Donna. Okay, so just some background to the survey that we carried out. We carried it out on social media in April 2020, as in we promoted the survey widely through social media, including by our 30 member patient organizations who shared the survey and did so much work to encourage people, to encourage their own members to respond to it. We had 680 responses, which, given the Irish population, is quite a significant response rate. Most of those people were people living with neurological conditions, with the remainder were family carers. And the majority were living with family members. We wanted to get a sense from survey respondents of who was living on their own and who were living with family for obvious reasons in terms of the impact of COVID. And we found that the majority of respondents were living with family. And in terms of the age range of the patient sample, most of the patients were between 40 to 60 years. And for the family carers, again, the majority were in that age group of 40 to 60 years. I'll just get the next slide there, Donna. On the left, sorry, they should read the patient sample there on the left, and on the right is the family care sample. In terms of the neurological conditions that were most preponderant among the two different samples, 63% of the respondents had multiple sclerosis, 13% had epilepsy, 9% migraine, and then in terms of, and there were responses from other conditions, but they were smaller. I'm just quoting those because they were the most significant neurological conditions in the sample. And for the family care sample, in terms of people with MS, 25%, Parkinson's disease, 18%, and epilepsy, 18%. And the next slide. We wanted to ask people about their main source of information on COVID-19. Now, what we found, and again, this was somewhat of a surprising finding, but maybe it shouldn't have been. In terms of general information on COVID-19 and prevention, symptoms, what to do if you experience symptoms, our National Health Services website, that's what I mean there by HSE website, that was the main source of information for 73% of the patient sample, and again, a similar percentage for family carers. Now, when we asked people about condition-specific information on COVID, in terms of their own risk for people with their specific neurological condition, people on a specific neurological medications, we found that the majority of people were relying on voluntary organization websites, patient organization websites, patient organization helplines. So there's quite a significant difference. For general information, they were looking to the National Health Service website or helpline, but when it came to condition-specific information, this was their best source of information on COVID. And just for myself, I went looking last week on our National Health Service website, and you really had to look for condition-specific information in terms of neurological conditions. It was there, but you really had to look for it, whereas it's very much front and center on the patient organization websites. Just the next slide there. We asked people if they felt they had sufficient information on COVID. Again, while rates of general information on COVID, and I have to say in Ireland, and I'm sure it's similar in other European countries, the government has led a public information campaign, very successful public information campaign on COVID. So everybody has that general information. But again, when it came to condition-specific information, what are the risks for my particular neurological condition, for the particular neurological medication that I'm on, we found that rates fell, with 35% there, the patient sample saying no, they didn't feel they had sufficient information on COVID. Again, one thing that really concerned us, and we are communicating this to our neurological colleagues, 1/5 of the patient sample, and again, a little bit higher for family carers, were saying that they didn't know how to contact their neurology service at this time. Now, we do need to get behind the figures a little bit there to find out why is that. Is it just that they're reluctant to be contacting, or they just do not have the contact details in place, even though they have been circulated? We certainly need to look at that a bit more and be more proactive with our neurological colleagues in making sure that people do have those emergency contact details. And again, in a situation where if your neurological condition deteriorates, do you feel you have sufficient information? Again, 1/5 of people saying no there, and a slightly higher proportion in the family care sample. And that for us is very worrying, that there would be 1/5 of people out there that feel they don't have sufficient information where to go for help if their neurological condition deteriorates. And again, that's in contrast to the high numbers saying if home help is impacted, if they're in terms of practical supports, in terms of general advice about COVID, they feel they have sufficient information. But when it comes down to their neurological condition and their neurological services, that's where the information seems to fall down. Thank you, Donna, for the next slide there. In terms of the impact of COVID for the patient and the family care sample, again, we probably weren't too surprised by these findings, but I suppose the scale of them it did surprise us somewhat. In terms of the financial impact, significant financial impact for the patient sample, 19%, some financial impact, 38%. So when you add those together, that is a very strong financial impact of COVID. And again, getting behind those figures, some of those are people, you know, people not able to attend work, their incomes falling due to COVID. And again, just falling between the cracks in terms of the supports that are in place. In terms of the impact on family life and relationships, that's where we really see the significance. So 1/3 there of the patient sample reporting a significant impact on family life relationships. Again, when you take the sum impact into account, of course, those figures are very high. And a significant impact on emotional well-being. Again, 1/3 reporting a significant impact and higher than among family carers. In terms of access to service, and again, this was one of the most in line with EFNA's own themes for this year. This was something we were very, very concerned to explore, access to service, because this was coming through from our own patient organisations and also from the neurologists that we're speaking to, of what was the impact? Were people trying to access neurology services? Were they staying away? Were they staying away with symptoms? Were they experiencing a worsening of symptoms because they were reluctant to come into contact with services? In terms of the patient sample, we found that for allied health professionals, speech and language therapists, occupational therapists, 1/5 were experiencing delay in accessing those services. We asked people about home care and home care support because we wanted to distinguish whether it was home care providers were withdrawing the service or family members or the individual themselves were withdrawing from the service because of their own concerns. And we found it was more likely that patients or family members were themselves withdrawing from home care because of their concerns around COVID, rather than a home care provider choosing or deciding not to provide the service. In terms of comments on access to services and what kind of services were impacted, we invited the patients and family carers to comment here. We found that the types of appointments, outpatient appointments being cancelled, patients who are dependent on regular infusions, injections, were experiencing delays or cancellations of those. Physiotherapy and other allied health therapies, as you can anticipate, services such as speech and language therapy, physiotherapy being cancelled, and some of those being available online. Treatment postponed, especially changes in treatment, and the neurology colleagues that have taken part in this webinar have explained in great detail and very, very well how this is impacting on neurology patients. A particular issue in terms of accessing MRI scans for particular patients, particular neurological conditions. Regularly routine MRI scans are essential to their treatment, and we would certainly have found from this survey people reporting concern around that, not being able to access an MRI, or certainly significant delays in receiving the results of an MRI. And then delays and difficulties in obtaining prescriptions for around medications. In terms of the family care sample, again, it was a similar picture. Outpatient appointments for the person with a neurological condition cancelled, similarly with physiotherapy and other allied health therapies. A delay in changing there may have been a plan to change the patient's medication. That is now on hold because the patient hasn't been reviewed or hasn't been reviewed in person. There may have been a telecall. And again, the decision being made not to change the meds at the moment, and just some patient anxiety, some family care anxiety around that. What's that going to mean? And then for family carers, they may have applied for home health support or additional home health support, and their application is on hold, or their application is pending. So they're very much, and I'll go into that a little bit more in a moment, they're very much stuck in a situation where everything that they depend on, and we're particularly concerned about family carers from this survey, that all of the supports that they depend on, many of them that they can't access anymore. In terms of testing experience, I said this was something that we really wanted to find out, whether as an at-risk group, people with neurological conditions were I suppose, higher than the general population in terms of testing. Now, I should qualify saying this by saying that when we conducted this survey, it was at a point where testing in Ireland was relatively low. Testing rates were relatively low in comparison to what they are at the moment. We've seen a huge stepping up of testing rates in the community over the past number of weeks. So if we did this survey now, I'm sure that we would find the testing rates for people with neurological conditions much higher. We've changed the criteria from 2 symptoms to 1. And there has been a real step up in community testing. So as I say, we found the testing rates and the incidence rates of COVID quite low, which in some way is probably reassuring. But as I say, the testing situation in Ireland would be quite different now in terms of there would be a lot more. I think we would experience similar rates of COVID, but we would if we were asking people had they been tested, we would probably be finding a higher rate of testing. Okay, then just the next slide there. I think that's the end of the slides. Okay, so just a couple of comments on the survey. Just in terms, I suppose, of the EFNA themes, the issue of access to services, it would certainly have been one of our main reasons for carrying out this survey. And certainly it would have, the findings from the survey would give us cause for concern as a result of that. What we found from the patient comments was not so much concern at the moment, but a concern that if anything happened to them, if their condition deteriorated, if they showed symptoms, an exacerbation symptoms, they had a concern around the help not being available or whether they should go seeking help. So there's very much a worry and a concern there of, I'm fine now, but if anything should happen. And we found, in terms of the day-to-day experience of people with neurological conditions, high degree of fear and anxiety coming out in their comments, fear of just normal interaction, even though our lockdown measures here in Ireland allow people who are cocooning to go out for exercise. We found a lot of people a little bit reluctant to do that. What we also found was that people living with neurological conditions, they're living in a family that's, I suppose, that there's an impact around them. There may be people going out to work, there may be children returning to school over the next few months, and they have anxieties around that. They're not living in isolation. They're concerned, their family members are concerned. So there's a whole family bubble around them that's trying to minimize the impact on them, that's trying to minimize their anxiety. But certainly we found that there's a whole range of issues around the entire family living with COVID and trying to accommodate the needs and concerns around the person with the neurological condition. And in terms of access to services, one of our concerns really is around people knowing what to do, people being able to, people feeling that they can access neurology services, feeling that they know how to and they have the right contact information, and also services being delivered in the right way. And someone made a very good point at the beginning of this webinar that online support may not suit everyone. Ireland has quite a significant population that are not familiar with using online supports and online services. So that sort of support may not be suitable for them into the future. We really have to rethink how we get services to that population. And as I say, one of our main recommendations is that certainly we need to do more to let people know what services are in place, what neurology services are in place, and how to get in touch with them. So that people feel really sure, even if they don't need the service at the moment, that they know that it's there if they feel the need to contact it, and also they have some sense of reassurance that services are coming back. One of the things we got from the survey in terms of patient comments was this concern that will I ever get back to my neurology appointments? What am I going to do 6 months down the line? Is my treatment, is my injection, my infusion going to be available in September when I need it, in October when I need it? So just this level of concern, there's certainly a need to be informing neurology patients more. And just in terms of the stigma and sense of isolation, one of the things we came across in the survey was this sense that because some neurological conditions are not visible, people with neurological conditions felt that their disability, their risk wasn't seen. So we had the example over and over of people cocooning and going out for some degree of exercise and people not being able to see because they have no obvious signs. They don't realize that these people are at greater risk. So these people are going for, they may have to go for their shopping, they're standing in a queue and people don't know to look at them, that they're at greater, that they have that vulnerability, that they're at greater risk. And this sense that the isolation and the stigma period experienced by people with neurological conditions is being exacerbated at the moment because they feel that they don't have the same visible signs of being at risk. And just, I suppose, the final thing we wanted to say was in relation to family carers. And we were certainly very concerned about the impact of COVID and family carers and this isolation and services that they depend on, respite services, day service support, all of those services that carers depend on, or even supports from other family members. We would have found from the comments of family carers this huge concern, this huge additional burden that they're now left on their own as a family. And they may have other caregiving responsibilities. They're either caring for elderly parents or caring for smaller children, and they have the additional needs of the person with the neurological condition. And as I say, very little services coming into the home, very little travel outside the home. So very much from this survey, a population at risk of impact on their physical health with their neurological condition, their emotional well-being, as I say, fear and concern about their future care.